Did you know that even a slight hormonal imbalance can significantly impact your health and well-being? Today, we'll explore 12 common signs of hormonal issues that many people often overlook. From subtle symptoms like hair loss and dry skin to more serious concerns like irregular periods and persistent fatigue, these can all be warning signals from your body. Stay tuned until the end to not only identify these signs but also learn how to restore balance and regain your inner health. Hormones are chemical messengers that regulate the functions of cells and organs. Modern lifestyles, stress, unhealthy diets, and birth control pills can often disrupt hormonal balance, negatively impacting women's health. 1. Hot flashes. Hot flashes are a sudden feeling of intense heat in the upper body, particularly the face, neck, and chest. This sensation is often accompanied by flushing, like blushing, and can last for a few seconds to a few minutes. They can occur at any time, both during the day and at night, when they are called night sweats. Some women experience hot flashes multiple times a day, while others only experience them occasionally. Estrogen plays a crucial role in maintaining body temperature. When estrogen levels decline, as during menopause, or due to prolonged use of birth control pills, the body becomes more sensitive to minor temperature fluctuations. The central nervous system, particularly the hypothalamus, which regulates body temperature, is affected by low estrogen levels, leading to inaccurate signals that the body is overheating. Regarding the thyroid gland, thyroid hormones can be influenced by low estrogen levels, causing metabolic dysfunction and increasing the sensation of hot flashes. Other triggers include birth control pills. Hormonal medications can temporarily or permanently disrupt estrogen balance. Menopause. This is the most common stage for women to experience hot flashes due to the natural decline of female hormones. 2. Racing thoughts and anxiety. The hallmark of racing thoughts is a mind that constantly races, unable to stop, leaving women feeling out of control. This is often accompanied by anxiety, a persistent feeling of unease, apprehension, or tension. Women may feel like they are in fight or flight mode, finding it difficult to relax or focus. Associated symptoms include a rapid heartbeat, unexplained fear or worry, difficulty sleeping due to constant thoughts, and increased irritability or impatience. Cortisol, the stress hormone, is produced by the adrenal glands and plays a crucial role in helping the body cope with stress. When cortisol levels are chronically elevated, often due to prolonged stress, the body remains in a state of constant tension, leading to anxiety, racing thoughts, and fatigue. Estrogen and progesterone, hormones that influence the central nervous system and emotional stability, can also contribute to anxiety. Fluctuations in estrogen levels, such as those experienced during the premenstrual period, pregnancy, or menopause, can exacerbate anxiety symptoms. Estrogen plays a role in regulating serotonin, the happiness hormone, and dopamine, the motivation hormone. When estrogen levels are low, serotonin and dopamine levels may decrease, making women more susceptible to anxiety. External factors can also trigger anxiety. A stressful lifestyle, including work, family, and social pressures, can elevate cortisol levels. Consuming excessive amounts of sugar and processed foods can impair the body's ability to regulate hormones, contributing to anxiety. 3. Vaginal dryness and loss of libido. Vaginal dryness is a condition characterized by a lack of natural lubrication, leading to dryness, irritation, and potential discomfort during sexual intercourse. Reduced libido, or a decrease in sexual desire, may also occur, making it difficult to feel aroused or reach orgasm. Other symptoms may include pain or discomfort during intercourse, vaginal itching or irritation, and an increased risk of urinary tract infections or vaginal yeast infections due to an imbalance in the natural pH levels. Estrogen plays a crucial role in maintaining vaginal moisture and elasticity. As estrogen levels decline due to menopause, postpartum, or certain medications, the vaginal glands produce less lubrication, leading to dryness. Low estrogen levels also reduce blood flow to the vaginal area, contributing to dryness and increased sensitivity. While testosterone is primarily known as a male hormone, it also plays a significant role in maintaining sexual desire in women. When testosterone levels are low, arousal and desire can be significantly reduced. Stress can negatively impact both estrogen and testosterone levels, leading to decreased sexual desire. Certain medications, such as antidepressants or birth control pills, can interfere with hormone production, resulting in reduced desire and vaginal dryness. The use of harsh chemicals in detergents and feminine hygiene products can disrupt the vaginal environment, causing dryness. 4. Hair loss and acne. Hair loss. This condition is characterized by thinning hair, hair loss in patches, or excessive shedding, particularly noticeable when brushing, washing, or waking up. Hair loss may occur on the crown, temples, or the entire scalp. Associated symptoms include a weak scalp prone to irritation, slow hair regrowth, or no regrowth at all. Acne. Acne manifests as inflamed pimples, blackheads, whiteheads, or cysts, commonly appearing on the face, back, and chest. Acne tends to recur or worsen during menstruation or periods of stress. Associated symptoms include oily skin, enlarged pores, and scarring or discoloration from untreated acne. Hormonal imbalances can significantly impact hair and skin health, particularly in women. High androgen levels, also known as male hormones, are a common culprit behind hair loss and acne. When androgen levels rise, sebaceous glands become more active, leading to increased sebum production, which can clog pores and cause acne. Androgen also directly affects hair follicles, weakening them and causing hair loss. Polycystic ovary syndrome (PCOS) is a frequent cause of elevated androgen levels in women, often accompanied by irregular periods and facial hair growth. Conversely, low estrogen levels can disrupt the hormonal balance, allowing androgen to dominate. This can occur due to menopause, stress, or poor diet. Estrogen plays a crucial role in regulating androgen levels, and its deficiency can contribute to acne and hair loss. Other factors can also contribute to these issues. Poor nutrition, particularly deficiencies in zinc, biotin, or vitamin D, can weaken hair and make the skin more susceptible to inflammation. Chronic stress elevates cortisol levels, a stress hormone that can exacerbate hair loss and acne. Using unsuitable cosmetics or hair care products can irritate the scalp, leading to hair loss or clogged pores, further contributing to acne. Finally, a diet rich in processed foods, sugar, and dairy products can stimulate androgen production, potentially worsening acne and hair weakness. 5. Oily hair and oily skin. Description: oily skin produces an excess amount of sebum, resulting in a shiny, greasy appearance, particularly in the T-zone, forehead, nose, and chin. It is prone to acne breakouts, enlarged pores, and seborrheic dermatitis. Accompanying symptoms: blackheads, whiteheads, or inflammatory acne may appear in oily areas. Oily hair. Description: hair becomes greasy quickly, even after washing. The scalp appears shiny and may experience dandruff due to increased oil production. Accompanying symptoms: hair may be weak and prone to breakage. Scalp itching or irritation may occur. Hormonal imbalances can lead to increased oil production, resulting in oily skin and hair. High androgen levels, particularly testosterone, stimulate the sebaceous glands to produce more oil. This can occur during puberty, in individuals with polycystic ovary syndrome (PCOS), or during menstrual cycles when hormone levels fluctuate. Imbalances in progesterone and estrogen can also contribute to oily skin. Low progesterone or high estrogen levels can increase the skin's sensitivity to androgens, further stimulating sebaceous gland activity. Other factors that can contribute to oily skin include poor nutrition. Deficiencies in zinc and vitamin B can impair the skin's ability to regulate oil production. Consuming excessive processed foods or sugary drinks can also increase oil production by stimulating insulin and androgen levels. Stress. Elevated cortisol levels, the stress hormone, can trigger increased sebaceous gland activity, particularly on the scalp and face. Inappropriate skincare products. Using harsh chemicals or products unsuitable for your skin type can lead to increased oil production. Environmental factors and habits. High temperatures and humidity can stimulate sebaceous gland activity. Washing your hair too frequently or using hot water can strip away natural oils, causing the scalp and face to overcompensate by producing more oil. 6. Cravings for sugar. This symptom is characterized by a craving for sugary foods such as candy, chocolate, cookies, or sugary drinks, especially after meals or at specific times of the day. You may feel unable to control this craving even when you are full or not truly hungry. You might also experience mood swings or fatigue if you don't satisfy your craving. After eating sugary foods, you might feel a temporary burst of energy, followed by a quick decline in energy levels. Hormonal imbalances can lead to cravings for sugary foods. High insulin levels, often caused by consuming excessive refined carbohydrates or sugar over time, can trigger cravings for sweets. This is because the body seeks to maintain energy levels quickly. Chronic high insulin levels can lead to insulin resistance, making it difficult for the body to process glucose efficiently, further contributing to sugar cravings. Cortisol, the stress hormone, also plays a role in blood sugar levels. Prolonged stress can elevate cortisol levels, increasing glucose demand and triggering cravings for sweets. Low serotonin levels, often influenced by fluctuations in estrogen and progesterone, can also contribute to sugar cravings. When serotonin levels are low, the body may seek out sugary foods to stimulate serotonin production, providing a temporary mood boost. 7. Breast tenderness. This symptom is characterized by pain or tenderness in the breast area, often described as discomfort or a feeling of tightness. It can occur in one or both breasts. The pain can range from mild to severe and may last for a few days to a few weeks. It typically appears before menstruation, during ovulation, or when estrogen levels are high. In some women, it may occur independently of the menstrual cycle, particularly if there are hormonal imbalances. Additional symptoms may include a feeling of swelling or fullness in the breasts, and the skin of the breast area may become more sensitive to touch. Hormonal imbalance can cause breast pain, and there are several factors that can contribute to this. High estrogen levels, which are often elevated before menstruation or during ovulation, can cause breast tissue to retain water and swell, leading to pain or tenderness. Low progesterone levels, which play a role in balancing estrogen, can also contribute to breast pain due to the imbalance between these two hormones. High prolactin levels, which are typically elevated during pregnancy or breastfeeding, can also cause breast pain and swelling if they are abnormally high. Other factors that can cause breast pain include premenstrual syndrome, PMS, where fluctuating hormones in the days leading up to menstruation can cause breast pain. Pregnancy, due to the surge in estrogen and progesterone levels, can also cause breast tenderness and pain. Oral contraceptives can also affect estrogen and progesterone levels, potentially leading to breast pain. Water retention, often caused by a high-salt diet or hormonal fluctuations, can cause breast swelling and pain. Finally, physical factors such as ill-fitting bras or strenuous activity can also contribute to breast pain. 8. Irregular periods. A normal menstrual cycle lasts between 21 and 35 days. Irregular periods occur when the cycle is longer or shorter than usual, the amount of menstrual flow is abnormal, excessively heavy or light, periods arrive early, late, or are missed for 1 or more months. Other symptoms may include severe menstrual cramps or no noticeable symptoms, changes in the color or texture of menstrual blood, and other accompanying symptoms such as headaches, fatigue, or mood swings. Hormonal imbalances can affect your menstrual cycle. Estrogen and progesterone, the two main hormones that regulate your period, can fluctuate. High estrogen or low progesterone levels can lead to abnormal uterine lining growth, causing irregular cycles or heavy bleeding. Low estrogen can result in a thin uterine lining, leading to light periods or amenorrhea. Elevated cortisol levels due to prolonged stress can suppress the function of sex hormones, causing irregular periods. Thyroid disorders can also impact your menstrual cycle. Hypothyroidism, or an underactive thyroid, can lead to infrequent or irregular periods. Conversely, hyperthyroidism, or an overactive thyroid, can cause heavy bleeding or amenorrhea. 9. Loss of eyebrows. Eyebrow thinning or loss, particularly at the outer edges near the temples, is a characteristic feature. The rate of hair loss can be rapid or gradual, depending on the underlying cause. Accompanying symptoms may include dry skin, fatigue, weight gain, or hair loss in other areas of the body. Changes in eyebrow texture, such as thinning, weakness, or slow growth, may also occur. Hormonal imbalances can lead to eyebrow loss, with hypothyroidism being the most common culprit. When the thyroid gland doesn't produce enough thyroxine T4 and triiodothyronine T3, metabolism slows down, affecting hair and eyebrow growth and regeneration. Other symptoms include dry skin, unexplained weight gain, fatigue, and depression. While less common than hypothyroidism, hyperthyroidism, or an overactive thyroid can also cause eyebrow loss. Estrogen imbalances, often experienced during perimenopause or menopause, can disrupt the eyebrow growth cycle. Other factors contributing to eyebrow loss include autoimmune disorders like alopecia areata, where the immune system attacks hair follicles, causing sudden hair loss and smooth, hairless patches. Nutritional deficiencies in biotin, zinc, iron, or vitamin D can weaken eyebrows and make them prone to shedding. A lack of protein in the diet can also cause similar issues. Chronic stress elevates cortisol levels, impacting eyebrow and hair growth. Mechanical factors, such as excessive eyebrow plucking or using unsuitable cosmetics, can damage hair follicles and lead to loss. As we age, the natural slowing of hair regeneration can cause eyebrows to thin over time. 10. Facial hair growth. This symptom is characterized by the growth of coarse, dark hair in unwanted areas on the face, such as the chin, upper lip, or cheeks. The hair may appear sparsely at first, but can become thicker and more prominent over time. It may be accompanied by irregular menstrual cycles, unexplained weight gain, or oily skin acne. You may also experience changes in your body, such as a deeper voice or increased muscle mass, in cases of severe male hormone dominance. Hormonal imbalance, specifically high androgen levels, can lead to unwanted facial hair growth in women. Androgen is a group of male hormones, including testosterone, which are typically present in low levels in the female body. When androgen levels rise, hair follicles in sensitive areas, such as the face, become stimulated, resulting in excessive hair growth. Polycystic ovary syndrome, PCOS, is the most common cause of elevated androgen levels in women. PCOS disrupts ovulation, leading to an overproduction of androgen. Other symptoms associated with PCOS include irregular periods, difficulty conceiving, weight gain, and obesity. Menopause or perimenopause can also contribute to facial hair growth. During these stages, estrogen levels decline, creating an imbalance between estrogen and androgen, making facial hair more likely to appear. Other factors that can cause high androgen levels and facial hair growth include genetics. If there is a family history of excessive facial hair growth in women, you may be more susceptible due to genetic predisposition. Adrenal gland disorders. The adrenal glands produce androgen, and when they function abnormally, as in Cushing's disease or congenital adrenal hyperplasia, androgen levels increase, causing facial hair growth. Medications. Certain medications, such as steroids or anticonvulsants, can elevate androgen levels in the body. Obesity. Excess body fat can stimulate androgen production and exacerbate facial hair growth. 11. Varicose veins. Varicose veins are a condition where veins, often in the legs, become swollen, enlarged, and twisted, making them visible under the skin as blue or purple lines. They commonly appear in the legs, particularly in the thighs or calves. Associated symptoms include aching or heaviness in the legs, especially after standing for long periods. Swelling in the ankles or feet, itching or irritation around the affected veins, and burning or cramping sensations, particularly at night, may also occur. Hormonal imbalances can contribute to varicose veins. High estrogen levels can weaken blood vessel walls, making veins more susceptible to dilation. This can occur during pregnancy, while taking birth control pills, or due to hormone replacement therapy, HRT. High progesterone levels also dilate blood vessels, leading to blood pooling in veins and varicose vein formation. Other factors that can contribute to varicose veins include increased venous pressure. Prolonged standing or sitting increases pressure in the leg veins, contributing to varicose veins. Genetics. A family history of varicose veins increases your risk. Obesity. Excess weight puts pressure on leg veins, increasing the risk of varicose veins. Pregnancy. Pregnancy puts pressure on pelvic and leg veins, and pregnancy hormones like progesterone also dilate blood vessels. Age. As we age, vein valves weaken, leading to blood backflow and pooling, which can cause varicose veins. Lack of exercise. A sedentary lifestyle hinders efficient blood circulation, increasing venous pressure. 12. Frequent infections. Characteristics of the sign. Description. A tendency to experience frequent infections, particularly colds, flu, sore throats, urinary tract infections, or skin infections. These infections may recur often or be difficult to fully resolve. Accompanying symptoms. Prolonged fatigue. Wounds or sores that take longer than usual to heal. A heightened susceptibility to aches and pains throughout the body. Hormonal imbalances can weaken your immune system, making you more susceptible to infections. Low cortisol levels, often caused by adrenal fatigue or prolonged stress, can impair your immune response. Similarly, imbalances in estrogen and progesterone can also compromise your body's ability to fight off infections. Low estrogen levels may reduce your body's resistance to bacteria and viruses, while low progesterone levels can hinder your body's ability to control inflammation, making infections more severe. High insulin levels, associated with insulin resistance, common in individuals with diabetes or prediabetes, can weaken your immune function, increasing the risk of infections, particularly skin and mucous membrane infections. Other factors that can contribute to a weakened immune system include chronic stress, which depletes adrenal glands and reduces cortisol production, leading to increased susceptibility to infections. Nutritional deficiencies, particularly in vitamins C and D, zinc, and iron, can also impair your immune system. Insufficient sleep can reduce the production of immune cells, making you more vulnerable to infections. Certain medications, such as corticosteroids or immunosuppressants, can weaken your immune system, leading to frequent infections. We have just explored 12 key signs of hormonal imbalance. These signs not only affect physical health, but also significantly impact our quality of life. If you experience one or more of these signs, don't worry. Start making changes with small habits. Eat healthily, reduce stress, and take better care of yourself. Don't forget to share this video with your loved ones so they can also benefit from this helpful information. Please like, subscribe to the channel, and turn on notifications to stay updated on future valuable content. I am always here to support you on your journey to better health and a fulfilling life. Wishing you all good health and happiness.